I just spoke with a friend. We all try to bring meaning to our life. And I was thinking just now that we actually almost don't exist. Our life is something like this. We've been born, but we've never been here for minus infinity. And then when we die, we're not here for infinity. So this life is kind of a blink of an eye. And it's actually kind of an illusion. So we try to pour meaning to it. So my mom got skin cancer. That's what motivated me to develop a skin scanner to detect lesion distortion. Now, what you see here, it's a simple image of a lesion, a color image. But if we try to catch skin cancer using color at late stage, that's what leads to high mortality rate. What we invented is scanning in different states of polarization or different state of field. And we come out with a lesion distortion. What you see there, it's actually the main, I can leave all my lecture on this slide. It's a new way of imaging, kind of a new MRI, X-ray, ultrasound, but now you have PAT scope, pattern scope, to see patterns underneath the skin. So let us define the problem. Cosmetic concern or skin cancer detection rely on color at late stage of the lesion, leads to high mortality rate. Our solution is to detect lesion distortion. So you can see here two lesions that we just had not long time ago in the skin center in Florida. In terms of pigmentation, they look more or less the same, but now you see that the cancer looks like an explosion from the middle outward, and this is actually the tissue deformities that cannot be seen by a bare eye, not in terms of color. Just think about the fact that probably since Galileo Galilei, he starts to carve lenses. Dermatologists and GPs have only this, just a lens with peripheral light. It's weird for hundreds of years. We bring here something which is, I think, in history, it's totally new. You even cannot compare it to anybody else because nobody done that and nobody extract the lesion distortion. So just to summarize the problem, the solution, instead of catching skin cancer or lesions using color at late stage, we're scanning in different state of polarization. And in my website, you can see the movement of light that stems from these distortions. And that's how we can generate a new family of imaging. We're going to approach dermatologists, general practitioners, nurses, but finally home use. The first person who got this scanner is my mom. I'm a nuclear physicist and electrical engineer and master and PhD in electro-optics. So I harness my knowledge in astronomy, in radiation, and in physics to this scanner. But the main target is home use. There is almost 1.9 billion people with lesion distortion, which is a wider problem. Skin cancer is just a subgroup of it. So just think about the market. We're in a market of 20 billion, but the telehealth, it's approaching 300, but I believe it's even more than that. The minimal investment would like $1.5 million for the first milestone, which is transferring the beta prototype that now today works at the skin center in Florida into a commercialized one. Another 1.5 to 2 clinical trials. We have regulatory strategy. We're about to pass the class 1 and class 2 for the professional market. And another 2, so summarizing, it's about $5 million. It's also to start producing it and ship it all over the world.